to engage some of the most vulnerable citizens in Birmingham who feel like they didn't have a voice and were not engaged in their own, in the policies or in the decisions around their own health. And so they ended up deciding to create a community garden. This is a beautiful collaborative effort between the team, the citizens themselves of that vulnerable community, and the hospital, the community hospital that served this particular area of the city. They worked with hospital administration, with physicians. They worked with the wellness clinic, the mental health clinic that's housed at that hospital to pilot it. And they, between the physicians, the nurses, the residents, the patients, and the team, they basically built a community garden to where the physicians and nurses and patients were working side by side to tend the garden. This was such a successful project. They received grant money as well to extend the garden. This was some of the first opportunity many of these residents had ever had to eat fresh produce, to grow their own produce, to use. They had an herb garden. Many of them had never cooked with basil, didn't know what was possible with food, with produce in their own cooking. And also, just frankly, for the mental health patients of this clinic, got them engaged and out of their house. There's one gentleman who came to the commencement, actually, who had been housebound. He only went to his appointments with his physician. Otherwise, he was so depressed he was always in his own house. And because of this garden, he was taking the bus twice a day to tend the garden and working side by side with his healthcare professionals and other people in the community. That's one of my favorite stories. There are others here that I don't have time to go into. One other one in Birmingham was a group that focused on educating teens about their health, and they ended up creating a Health eTeen website that was going to be actually co-created and run by teens in the community alongside physicians. And they got a grant of about $80,000 in the end to create the website, piloting an HPV vaccine campaign where they were going to sync up texting as well as